Hold up, is this you?
Do you have multiple sexual partners?
Are you sexually active at a young age?
Do you have a weakened immune system due to an illness or medication?
Well, you may be more susceptible to contracting genital warts and spreading them more quickly.
Genital warts, one of the most common STIs contracted, are caused by HPV, which is human papilloma virus. The warts can appear as one or more painless growths formed on or sometimes on the inside of the genitalia, such as the vagina, cervix, vulva, penis, or anus, and even sometimes on the throat or mouth. In many cases, they can be so small that they are not even visible. Generally, however, most HPV infections do not have very many visible symptoms, and the infection eventually dissipates within 1 or 2 years.
They are described to have a cauliflower-like appearance and can be either flat or raised. However, they may not even be visible to the naked eye, as a person can carry the virus despite not having any visible symptoms. These kinds of infections can affect both men and women, but it is often detected more frequently in women as the HPV may cause cell changes in the cervix, shown through a pap smear.
Unsafe sex can possibly lead to contracting HPV and further getting genital warts. There is a possibility of you contracting the virus if there are any skin-to-skin contact between you and an infected person. This includes anal, vaginal, and/or oral sex.
Genital warts can be an unattractive addition to your appearance. Therefore, you may choose to use one of the various options to remove genital warts. However, this does not remove the virus. These options include imiquad cream, which is to be applied once a day, 3 times a week, for up to 3 months.
Cryotherapy is another form of removal for genital warts. This treatment involves the process in which the warts are frozen off with the use of liquid nitrogen or dry ice. Laser or diathermy treatment is another possibility, but this is mainly used for a large number of warts or when other treatment options have not been effective. Keep in mind that genital warts might reappear after treatment. However, don't worry, because this does not necessarily mean that you have contracted the virus again. In most cases, the warts will disappear completely and not reappear.
If genital warts are left untreated, they can multiply. However, this generally does not affect the severity of the virus.
Similar to other STIs, the best form of prevention is abstaining from any form of sexual activity. The risk of spreading or contracting genital warts can also be reduced by practicing safer sex, such as using condoms during anal or vaginal sex. However, the fact that condoms only protect the area that they cover should be noted, as they are not able to cover all the exposed genital skin during sexual contact.
Condoms are the only form of contraception that protects against STIs, and they can be accessed from service stations, supermarkets, and pharmacies. Other forms of prevention, specifically for women, include a pap smear, which would reveal whether you have genital warts or not. Women should have regular pap tests from the age of 18 or 2 years after having your first time, and continue until the age of 70. An HPV vaccine is also available, and in Australia, both boys and girls receive free HPV vaccines in Year 7. Women who have received the HPV vaccine should still continue regular pap tests.
So, before entering the dangerous world of sexual activity, remember these facts and remember to practice safe sex.
Created using Powtoon.